Doctors of Reddit, what's the biggest case of faking it you've ever seen? 30-year-old woman came to the ED with such excruciating belly pain, paralyzed. Oh god, it hurts when you press there. Must have oxycodone now. ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. Doctor should get a side gig as a personal trainer. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses. But the doctor was a little concerned because the tests indicated she needed really thick glasses. And usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she needs some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. I remember I faked it when my brother got glasses because I thought they were cool. Turns out I actually needed glasses. They found an astigmatism in my eyes. Who knew? I never knew I needed glasses. I mean, how am I supposed to know what the world looks like to other people? Then I was amazed that I could see every detail of a tree. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. A friend of mine likes to stick out her hand for a handshake when people come in feigning blindness. Nearly all of them instinctively meet her handshake. It's great to watch. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the tongue open, a device you poke them directly into the eye with, and they go, "What the fuck is that thing?" I have a sort of opposite angle story for this one. A friend of mine is completely blind, as in, eyes removed as a toddler blind. She had a rare cancer. She's worn glass eyes her whole life to keep the sockets from sinking in, as well as to limit the jarring appearance. Well, she had a new doctor she was seeing, so to speak, to get fitted for new glass eyes. I think that was why. When the tech brought her in, they told her they had to examine her eyes. And asked her to read the vision test chart. She kept trying to explain she is blind, blind, and they were stuck on examining her. "Whoa, your pupils aren't responding." No shit. She finally got so frustrated, she popped one glass eye out and said, "Here. Now you can check it out all you want." She apparently always would pull that gag on folks doubting her or teasing her. She's awesome that way. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom, just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells, and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. I was worried you were going to drink it in order to make yourself sick. Thank goodness that is not what happened. I never ever came clean about it either. He talked about that puke till the day he died. He thought I was dying because of how bad it smelled. I told my dad a lot of my stunts as I grew into an adult, but that one stayed in the vault. Puke thermos, not a great idea. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual "I'm crippled" paraphernalia: crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood, because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic with her "I'm crippled, get up on again." A few weeks later I got the subpoena for the deposition, and it all became clear. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. There's an even easier way. Just take their hand, hold it over their face, and drop their hand. If they're truly unconscious, or drunk, or very out of it, etc., they'll smack themselves in the face. If they are conscious, they will always do something to lessen the hit, like make their hand land to the side, or they turn their hand and hit somewhere they think it won't hurt, etc. Works, but some other Redditors have mentioned that you can give them a black eye if you do this too carelessly, and they're actually unconscious. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. 4th-year medical student. On my ER rotation, and a trauma came in from a woman that had been arrested. During the drive the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled bullshit, but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay. Though some of the nurses said that they caught her peeking at us when would leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out, and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course his eyes were back to normal and focused. Guy came to ER. I was a nurse at the time. For stomach ache when asking him about history, he randomly mentions a fight with his girlfriend where she left in a tizzy and he fell asleep on the couch. 20 minutes later when we see the CT, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. ER nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumb ass back to the waiting room to contemplate his stupidity. Obligatory, not a doctor, I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc? How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on insurance form. Doc loses his shit in staff room laughing. Next week the patient loses his shit in reception because his insurance has been cancelled. Haha. I used to know a guy who badly injured his back at work and got lifetime compensation. It really freed up a lot of time for him to train for cross-country ski races. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests, didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So I update them saying everything is fine, tests are negative, you can go home. Patient gets up, gets dressed and walks out without a word. Do you have a similar story? Leave a comment and subscribe to the channel if you want to see more videos like this one.